Welcome students. Happy Onam. Today I am thinking of discussing few questions because we have less time for the exit exam. This is for Diploma in Pharmacy student exit exam. Already we have discussed some questions in hospital and clinical pharmacy subject, and today we are also going to discuss some few questions in hospital and clinical pharmacy according to the Diploma in Pharmacy syllabus. And it was interesting to know, to revise the knowledge even for the other students who are preparing for other exams like various entrance examinations for pharmacy profession. Also it will be useful. So once again today I welcome you, and I am just giving the wishes for Onam festival today. It was an interesting festival and it is an important for the holidays, but still this is just have a discussion about your revising your knowledge. So in this the questions which I have taken from this portion is: Wallace rules. That is Wallace rule of 9. They have asked Wallace or Wallace rule of nines, N-I-N-E-S, it may be written in many places, in many books and reference. Nines is used in the treatment of, they have asked, and they have given a choice of gangrene, burns, infection, dehydration. Gangrene, you should know some of the things. Gangrene means which cause a damage due to the cells damage due to less supply of blood to the area, and symptoms may be darkened skin and darkened area, sometimes some that is very bad odor can be seen, and it can be treated, but most of the time it may be cause even death also. So but that is also a critical disease or critical infection which may cause to the patient. And burns, you know very well, it is critical. So why this burns is used for this Wallace rule of 9 means what is nines? You can see this, actually they have the surface area of the affected burns is calculated by Wallace rule of 9. That's what the student should remember. Wallace rules of 9 means the area of head and neck 9%. It is calculated by the surface area, and the arms is also upper arms 2 are divided in the front side and back side of 9%. And trunk means it included 9, that is 4 areas like stomach, chest, and all this area in 9 only. Actually 9 into 4, you can see 36% is used for the trunk area, and genital area is 1%, front and back together. And then you can see the lower limbs also 2 have been 9 into the multiplication of 9, 18% of each have been taken. So you can see this is how their surface area have been calculated, and it has been given 9% of each area except the genitally part. But that's why it is, the rule was named to Wallace rule of 9s. So this students should remember. But when you see gangrene is different, and infection you know very well. Normally many infections are there. So dehydration due to sometimes diarrhea or less water content intake, this all causes sometimes loss of fluid from the body can also cause dehydration. But we are not applying this rule. This rule in clinically we should know that what is the application of this Wallace rule of 9s means. You should remember immediately calculating the surface area when the affected by burns. The Wallace rule of 9s, see here I have written in the slide, is a method used to estimate the total body surface area affected by a burn or an emergency time. It is used by the pre-hospital and emergency medicine. So that's what you have to remember. The second question or the 14th question which we are discussing in this subject, that is Plastibell device. What is this Plastibell device is used in? They have given a choice of hernia repair, circumcision, tracheostomy, thyroidectomy or thyroidectomy. So you should know all the other words also. Circumcision is a type of small surgery which is made or applied by this Plastibell device. So we should know what is a Plastibell device. And other things also, hernia repair also, some idea you should know. Hernia repairs means muscle have dislocated, maybe near to umbilicus, some pains will be there. Lifting heavy may cause in the area of the, you can see the thigh, between the thigh and the lymph node area, maybe having the muscle coming down, and also chest also sometimes the muscle types of hernia, that means the lowering or uppering this dislocation, or you can see location can be moved by means of giving more pressure by lifting heavy weight also may cause. So this can be by means of surgery, it can be made into right by means of pulling into the proper place and again stitching by means of giving the proper position to the muscle is possible to relieve from the hernia repairs. So that's what I want to show this picture, and you can see this is the circumcision using the Plastibell instrument. You can see in the outer skin of the penis area, keeping the Plastibell device in this manner, like how for example a plumber, how he removes the cap, and in the PVC pipe it can be even easily made to remove the outer skin of the outermost area of the penis can be done the circumcision. So you can see this is the method of using. You should remember the Plastibell is a device which is used for circumcision. And you can see this another that is choice they have given is tracheostomy, that is tracheostomy, not tachy, tracheostomy. Tracheo means, what do you mean with trachea? The tracheal area where is the throat, we are putting one insertion, and that you can give it can be connected in the lungs area, the fluids formed can be removed, and it can be this type of tracheostomy can be done for maybe the phlegms are removed even in various type of infections in critical time. Sometimes we are using for patients who have been affected totally, the lung is affected in you can see there is in various type of conditions you have to remove the fluids which has been produced in the lungs, can be done by tracheostomy. So that's what the picture which shows. And also this is another one, thyroidectomy or thyroidectomy. Thyroid. You can see the parathyroid gland which is shown in the picture. In the second picture you can see after surgery it is completely removed. If it is by means of diagnosis, that is you have to remove, the surgeon can also remove the complete the thyroid gland or the parathyroid gland can be removed in the area which is shown in the neck by the picture which you can see, that is called thyroidectomy. So you can see the circumcision by means of the answer Plastibell. We have come across all these definitions to get understand for the students. I hope this will be more helpful for you to even to write the exam or to make yourself comfortable, even though if they ask in other ways of any type of question which is related to these other choices which is given in this MCQ. And the next one is the 15th question. The color of the container used for the disposal of waste sharps is. So this question was little vague. They did not use any word, that is sharp waste. Sometimes sharp waste may be hazardous, and also sometimes it is infectious or used one, sometimes unused one, damaged one. This type of things are also there. But it is any of the sharp waste in medical. We may be knowing about the needle waste and scalp scratching blades, and these all used for various purposes. What type of containers can be used? So we should know what all the containers available in the medical area. We can see these all the containers with color, which can give to denote and to collect the waste, and it can be disposed. It should be dispersed. It should be the dispersal of the waste is also a very important factor to reduce the communicable diseases, and also prevention for the patient in the clinical side is very important job for the health workers. So you can see that is biohazardous waste, red color with denoted with the symbol. You can see that is any contaminated with potentially infected material or infectious material such as blood, sharps and more, also referred to as an biomedical red bags or infectious waste can be added there. Sharp waste, any device with the capacity of precise, that is, or you can say precising the skin, such as scalps and needles, wires and more can be added here in this red box. And pathological waste also, we have given a red box color with path which is written there, and tissues, organs, fluids and body parts from the surgical like procedures. It has to be used this type of color for the vessel for collecting this disposable waste. And trace chemotherapy waste, it should be yellowish color which is shown there with the symbol. We can see any contaminated with a trace amount of chemotherapeutic agents such as gloves, disposal gloves. These all things should be used for this chemotherapy waste, should be yellowish color. And the blue color non-hazardous pharmaceutical waste. What are they? And unused over the counter OTC drugs, that is not hazardous, expired. These all as a definition by the resource, definition given by the Resource Conversion and Recovery Act, that is RCRA. The Resource Conversion and Recovery Act. According to that, anything is non-hazardous pharmaceutical waste in a blue color box. And you can see black also is there, hazardous pharmaceutical waste. What are they? And unused over the counter, that means OTC drug also, that is hazardous, is defined by the RCRA, that means the Resource Conversion and the Recovery Act, which has been given this hazardous definition for the pharmaceutical product. That should be put, or that should be dropped in the black type of vessels. This means the pharmaceuticals or pharmaceutical products is toxic, corrosive, reactive or ignitable as defined by the CFR. CFR means the Code of Federal Regulation. According to the Code of the Federal Regulation, it should be done. So for us it is red color. This is the box which you should use for containers used for the disposal of waste, sharp. is red color. So I have given the explanation, even though for all the other waste which can be given. So this will also be helpful for the student to answer any type of choice if they have asked. And the next question, you can see hepatitis. We might have heard about hepatitis B, hepatitis C, and this liver problem is very common. So when you are clinical side in hospital pharmacy, the students, they can expect this type of questions. They may ask in percentage, 10%, each subject for exit exam. So you can see they have given a choice like whether hepatitis is an bacterial infection, or it is an protozoal infection, or fungal infection, or it is a viral infection. You should answer is viral infection, but you should have an idea about what is the bacterial infection. You know that bacterial infections can be treated with antibiotics, and you can say parasitic, it comes protozoal infection like malaria, and also you can see amoebic dysenteries. And they are, all of them are protozoal infections. There is parasitic infection. Fungal infection, you can see fungal, antifungal drugs you have to use. And you can see there is another one word is prion disease. Prion disease means compression of proteins in the brain can happen. The conduction can be, it also can be pathological function or pathological infection can also be created due to the compression occur in the protein molecules in the brain. And so this is also one type of disease. There are different types of infections can be seen by means of various types. So this hepatitis is a viral infection. Next question is hospital acquired infectious. Hospital acquired, from hospital you are acquiring an infection. What is it called? Whether it is a primary infection or a secondary infection or a nosocomial infection or latent infection. When you are getting or acquire an infectious infection from hospital, then it is called nosocomial infection. That is the answer. But you should know what all different types of infections are there. For example, there is primary infection is there, reinfection is there, secondary infection, secondary stage of infection, it will be more critical, and focal infection is there, cross infection is there, nosocomial infection which is acquired from the hospital infectious, and you can see introgenic infection is there, endogenous infection is there, exogenous infection is there, latent infection is there. So these all infections you should just have a reference. They may ask you sometimes the question in different form. So what is this nosocomial infection? How it can occur? You can see this contaminated medical staff and visitors can also give chance of communicable virus, communicable bacteria, communicable diseases in hospital facilities which you are using like toilet, wash basin and any other whichever you are using there. It can directly infect the patient, indirectly it can infect, and directly you can see the medical equipments, implements in the device, even the equipments which is used for surgery directly, or you can use like the stethoscope or the instruments which is used for analyzing in dental care. They are using gloves. These all directly, even giving some IV fluids, that is the needles which you are using, they all can also give some infections to the patient directly. That one is called nosocomial infection. So I hope the student will be very clear to answer this. And the next one, 18th question is one among the following is a communicable disease. So you should know what is communicable disease. Communicable from one person to another, and it will be go on spreading like we know very well. Almost all the students will be know about the corona. It's a communicable disease, but virus, it's a virus. So you can see they are given a choice. Cancer, it is not a communicable disease. Diabetes, it is not a communicable disease. Hypertension, it is not a communicable disease. But filariasis is a communicable disease. Filariasis is caused by Wucheria bancrofti, the virus, that is the bacteria or the organism which is responsible for producing this filariasis, which causes the enlarged limbs. You can see this very clearly, and how it is coming from mosquito. It is a communicable disease. It comes from mosquito. That is, you can see the L3 larva which has been put into the mosquito bite into the humans, and it developed in the human stage. In the second one, adult lymphatics, and then the adult produce a sheathed microfilariae from Wucheria bancrofti that migrates the lymph and the blood stains in the form of like a worm, and the structure you can see, and you can see the limbs. It's affecting the limbs and the whole body. The blood, it has been developed, and the mosquito, when it bites in the fourth stage, it takes the blood from the human, and it can bite another human also. So what happens when it bites? It takes the blood as a meal, and this microfilariae, the microfilariae spreads in the sheath, penetrate into mosquitoes in midgut, and migrate to the thoracic muscle, and becomes L1 larva, and then becomes L3 larva, and L3 larva migrates the head of the mosquito, and probus sticks, and then the mosquito, when it is bites the human, the L3 larva enters into the skin of the human, and there it has get again the cycle. So this is a communicable disease, filariasis. So filariasis, you should remember, the Wucheria bancrofti is the organism which is responsible. This is the picture I just want to show you. The mosquito bites can cause this filariasis. Is a communicable disease which has been eradicated almost, and still it exists in some places. And the minimum qualification required to start a community pharmacy is, this everybody knows, is a simple question, Diploma in Pharmacy, D Pharm. They are given a choice, D Pharm, B Pharm, M Pharm and Pharm D. But you have to select the D Pharm is the minimum qualification in India required to start a community pharmacy. And in 20th question, Catgut. So catgut we used to say. So given a choice, catgut is made up of from the intestine of domestic cat, wild cat, sheep, horse. But we will be getting a confusion because cat means we will take catgut, so it may be taken from cat. But it is not prepared from the cat, it is prepared from the sheep intestine. So catgut sutures are prepared from intestine of the sheep. You know very well the sheep intestine is used for preparing catgut, and for the sutures which is used for very much useful for the surgical sutures preparation. A drug which expels out cough from the bronchi is called as, that is, expels, or the sputum expels, it should be added actually, expels this sputum from the our bronchi or in the area. It will be expelled means you need something which will induce the expel movement of the ciliary movement externally. So that can be given by expectorant is the answer. They are given a choice of syrup, suspension, mucolite and expectorant. Expectorant, ascoril, I have just taken a picture to show you. There are many expectorant like Benadryl, but mucolites also used for cough, but they are used like for like codeine syrup also used to soothe, or to even honey also can be given for suppressing certain minimum cough also can be. But it is, if it is a sputum is more and to be expelled, the phlegm should be expelled means you need expectorant. Next question, a drug that prevents infection and decay is called as. That means a drug or a chemical or a drug which can prevent infection and decay. It can prevent the infection and the decay of a tissue or a cell. Then that is called antiseptic. Before septic, septic means something which is infected, something which is decayed, something that before infection, protect before infection, protect from decay. That means antiseptics. Anti-malarial drug, they are anti-protozoal, that is for example germicide or liver. These are all not correct, the answer of choice. So you can see what is antiseptic are the drug that prevent the infection and decay by killing or stopping the growth of microorganism. They are also known as, there is bacteriostatic and bactericidal, you might have heard about that. So they are also, both of them antiseptic. So they are also known as skin disinfectants and are used to clean wounds and skin. Gentian violet. Gentian is violet is one of the solution which you might have seen for using antiseptic for dressings they used in the hospital. Is a cause example for antiseptic dye, prevents bacterial and fungal infection also, it can be prevented. Next question, in hospital the oxygen tubes are for respiration, contain oxygen and what is the other gas will be there. So you should know that 100% oxygen or pure oxygen you cannot supply. It will make the person in trouble with accumulation of solution in the fluid in the lungs and he will die. So even oxygen cannot be supplied. So you should need a certain percentage of oxygen only given to the through nose or to the intubation. So you can see nitrogen is added or helium is added, argon is added or carbon dioxide. It is added in helium. You can see oxygen tubes in hospital contain oxygen and helium. A mixture is called heliox. Heliox, you have to remember, the heliox is the name oxygen which is given for a person which is suffocated. When you know in corona most of them were getting, we need oxygen for the suffocation, we need for the anoxia patients they need. So you can see that even for the child picture which I have shown here, lung protection can be given by supply of FiO2 is the symbol. So FiO2 means it is denoting the oxygen content actually. That is the FiO2 means actually they used to say it is the content to be specified of 100% wall supply and 79% of helium and 21% of oxygen. So oxygen is only 21% of FiO2 is used to supply in the form of name is heliox. So you should know helium is the gas which can be mixed with the oxygen to maintain the 21% of oxygen which is required for the respiration for the normal human being, which can be used. Not used the completely oxygen, it will cause damage to the lungs, it will cause even death. It is cause death to the patient by means of accumulating blood in the lungs. So you see number 24, next question, the role of a hospital pharmacist is, what is the role of hospital pharmacist? A pharmacist, when you are, what are the roles? They are given some choice like ensuring inventory. Inventory control, you should do, you have to do the inventory control, entry of ledger and maintain the trial balance. These all things, inventory control, inventory should be there. Very important, invoices, incoming drugs and the drugs distribution, everything should be recorded. The bookkeeping is very, very important. It's a job of the pharmacist. Dispensing medicine, it's job of the pharmacist. Monitoring medicine safety, very important. And also even included many other things, following up of the patient, whether they are adhering to the for the drugs which is given by the for the treatment. These all things comes under pharmacist job in a hospital, pharmacist, clinical pharmacist. So the answer is all of the above. And the next one you can see other names of regenerated cellulose. What is the other name for regenerated cellulose? What do you mean by regenerated cellulose? Regenerated cellulose, is it wool, hemp, silk, rayon? But actually cellulose, or you can see the paper is made up of cellulose. Cellulose which we have taken from the plant source, which we are using for various production of even band-aids, plasters and various surgical or dressing materials which we are preparing, the regenerated cellulose. So you can see this is a regenerated cellulose, which is just the wound have been pasted with this regenerated cellulose. The regenerated cellulose is called rayon, is a man-made fiber that is made by converting natural cellulose into a soluble derivative and then regenerating it. Rayon is a generic term for all regenerated cellulose fibers. So included what all the other regenerated fibers means viscose, modal and lyocell. So this you should remember about this viscose, modal and lyocell. They may ask sometimes other regenerated cellulose name. So this is the products which are available in the market for dressing material, which can be gauze. These all prepared from the rayon or the regenerated cellulose. So 26, the next question, which one of the following is not a salient feature, the important feature or the required feature of the hospital pharmacy? It's not an important one. That means what you can see, they have given a choice like supply and storage of ancillary product is a required one, is a salient feature. Designing a new drug is not a salient feature. It is also comes under pharmacy, but it's not in our hospital pharmacy. A new drug design, that is done by the research oriented. Supply of pharmaceutical drugs is done by hospital pharmacy, is a salient feature. Dispensing of narcotic products, there are many other duties, but these all comes under supply of storage and ancillary products, supply of pharmaceutical drugs, dispensing of narcotic products are a salient features of hospital pharmacy. But design of a new drug is not a salient feature of the hospital pharmacy. Which one of the following is not an adhesive plaster? So in the choice itself they have mentioned Belladonna, Capsicum plaster they are. And Plaster of Paris is not a plaster, but it is also having the sticky nature. Capsicum plaster is available. Zinc oxide plasters are available. Combination of Belladonna and Capsicum plasters for various muscle pains. You can plaster can be used, and Capsicum plasters, the thick one, can be kept there by means of transdermal activity. They can relieve the pain. And you can see the zinc oxide plasters which are using for various dressing materials and also for antiseptic activity, which can be used for various purpose. Zinc oxide plasters are also available. But you see Plaster of Paris is not coming under an adhesive plaster, but they are powders which is made for various ligament ruptures, bone fractures, and even for development of teeth. You can see for the mold or to impression, taking the impression of teeth, you can do with Plaster of Paris. So Plaster of Paris is also clinical application, but they are not adhesive plasters. So now the students have an idea about what is the Plaster of Paris application, what is the Belladonna plasters, Capsicum plasters, and you can see zinc oxide plasters. So these all knowledge is needed for any other options of questions also. 28, pick the odd one of the following type of dressing. That means what is the 4 choices, which one is not related to the dressing matter. So dressing, cleaning and dressing the wounds, you can see sanitation, absorbents, band-aid, protective. Absorbent, band-aid, protective, these all things will be used for any type of wound dressings. But sanitation is not coming for wound dressing. Sanitation is, you can see, washing your hand. Sanitation is one of the important thing, which was more, sanitizer was started using only after Corona. After 2020, 1990, December, after December, many people, they got lot of business by means of producing sanitation liquids and sanitation sprays, and many things are available. And this sanitation was used to remove the coronavirus, which may be transmitted, communicable when you are traveling. It may be, so they were not able to, they were used to wash their hands and wash everything whenever they are coming into any places. So this sanitation is different from dressing. So that's why you are just making the answer. Sanitation not comes under the dressing category. So the next question, National Leprosy Control Program was launched. They are given years 1963, 1968, 1954 to 1955 and 1978. But actually 1955 is the correct answer. But they have given a choice of 54 to 55 by specifying that it started from 54. But actually natural leprosy eradication program was done in 1955. So the answer is 1955, but they have shown that it is 1954 to 55. So we can choice is 54 to 55 can be taken. And the toxin induced muscular twitching and convulsion treated with. So they have asked, this is somewhat treatment and pharmacology, and the hospital pharmacist should have a knowledge about the therapeutic application of a drugs actually. So the toxin induced, you should remember, toxin can induce like strychnine, which is Nosocomial, they can cause this type of muscle twitching and convulsion treatment when they are poisoned. So strychnine poisoning, treatment by the strychnine poisoning includes Diazepam, barbiturates can be given. This can usually intravenous control the convulsion. A person who is having more seizures and due to this poisoning of this strychnine, the treatment of toxin induced muscle twitching and convulsion depends on the type of toxin first of all and the severity and the condition. But still the choice of drug can be given is Diazepam, or you can see barbiturate, phenobarbital. So here they are given 4 choices like Dicobalt, edetate. What is Dicobalt edetate? Remember, Dicobalt edetate is an edetate. It is a chelating agent. It is used for cyanide, that is cyanide poisoning. It is actually Dicobalt, that is cobalamin. Dicobalt edetate. It can be used as an antidote for cyanide poisoning patient. And dimercapol or dimercapral. The dimercapral is used for mercury poisoning. It is also an antidote for mercury poisoning. And you can see flumezanil or you can say flumazenil. They used to say flumazenil or flumezanil. You can say flumazenil is the right pronunciation. Flumazenil is used for as an antidote for a patient who have been poisoned by benzodiazepines. Benzodiazepine poisoning can be treated with flumazenil as a drug. So you remember these all antidote name which I have expressed with you. This will be helpful for you to remember in your examination time if they ask in other words also that they are antidotes for this poisoning. But here in this muscle twitching and convulsion induced or indicated or produced by means of poisoning by means of example of strychnine, that can be treated by phenobarbital or that is barbiturates or benzodiazepines. So diazepam is the answer in the 30th question. And 31st you can see this is also a very interesting question, serotonin. syndrome. What is the serotonin syndrome? What is the serotonin? Serotonin is also a secretion or a hormonal, you can say it's a secretion which has been produced in our body like histamine. Serotonin syndrome is also causes like allergy, like what all the histamine produces, this also produces the same system. So serotonin should be controlled. So serotonin overproduction may cause various system damages, system allergy, redness of skin and various type of same system whichever causes by histamine H2 and H1 receptors, H1 receptor, HT1 receptor which causes can be seen in even in serotonin. So this serotonin having another action in the psychotic or in the central nervous system also. When the serotonin, it can cause even see that serotonin symptom, it can have mental state differences, dryness of the mouth, sweating and hyperthermia, diarrhea, nausea and tremor and muscle rigidity, and you can see even see there is somewhat mixing of mood also can happen by means of serotonin syndrome. So serotonin syndrome, not only that, so the choice of the drug is not this cyanokit. Cyanokit is used for, it is also a derivative of this edetate, that is for example edetate. Just now we have seen that cyanoedetate which is used for cyanide poisoning. This is also a cyanocobalamin, or is also hydroxycyanocobalamin which is present in the cyanokit, which is also used for poisoning of cyanide. And diazepam, you know, it is used for sedation and for anxiety we can treatment, but it is not having any much influence with the serotonin to control. And when you come to dantrolene which I want to show is dantrolene, they are given a choice. What is dantrolene? Dantrolene is an, what you can say, it is a skeletal muscle relaxant. It can be used for treatment for skeletal muscle relaxant. It is directly, it will relieve pain, so it is not connected with this that is serotonin syndrome. So serotonin syndrome can be treated with for example hypohepatidin. Hypohepatidin as I told, it is mental disorder, like in children also it can happen. It can be studied, have been given stimulate related appetite suppression and insomnia in children and adolescents. When the children are coming to a stage of adolescent with an attention deficiency, hyperactive disorder, ADHD is commonly acquired in even in elders also. Putting a pressure over somebody, the children putting pressure to the mother, or a mother putting pressure to the child, or the father to the child, or the child to the father, and like that putting the pressure over that means a hyperactive disorder, attention, something which is making very perfect needed. These all things can occur by means of overproduction of serotonin. So it can be controlled by means of hypohepatidin usage can also be used. So you can see next one is Cinemet is a trade name. Actually Cinemet is not a drug name. It is not a generic name. Cinemet is a combination which is allowed actually. It's a combination which is allowed and reasonable combination. It's not like other combination which is burned by our schedule C1 and C2 in new Drug and Cosmetic Act. So you can see Cinemet is a combination produced containing that is carbidopa and levodopa in the ratio of. They have given a ratio 1:5, 1:10, 2:8 and 1:8. But 1:10 is correct. That is 1% of carbidopa will be having 10% of levodopa in combination. 1 milligram of carbidopa is there means 10 milligram of levodopa will be there. It may be according to the dose I have not given you, but still the ratio when there is. But we should know why you have to mix up with carbidopa and levodopa. What is its use in this combination? What is its application? For what disease it has been given? So students should know very clearly this levodopa is used for Parkinsonism disease. You should know what is Parkinsonism disease first. Parkinsonism disease, which is caused due to the less production of dopamine in the CNS and it causes mainly, I am not telling about seizures, and it causes tremors and various coordination, memory. These all things will be getting affected by means of this Parkinsonism disease. So this is can be prevented by means of a drug which is given by levodopa. So why this carbidopa along with levodopa? What is its action? Levodopa is a drug which can enter into this blood-brain barrier, and it causes and acts, it will causes the production, it helps the production of, or it can be converted into dopamine also. So it can be used for production of dopamine, and it can control the Parkinsonism disease. It can even help in reducing the seizures, and the coordination of the muscle conduction, nerve conduction can be even nerve conduction. Mainly it can be a neurotransmitter dopamine can be facilitated and be secreted or supported by means of levodopa. Then again, why then carbidopa? What is the use of carbidopa in this 1:10? Carbidopa is also useful. It is used for not to get until the levodopa enter into the CNS. The levodopa should not get deteriorated, should not get converted into dopamine in the peripheral region. So carbidopa is protecting the levodopa not to get converted into dopamine in the peripheral region or in the lower region, which is in the muscle, which will be even wasted. So it will support the levodopa until to reach to the brain area, until to recross the blood-brain barrier. So that will be helpful for acting as a very good combination of drug in treating Parkinsonism. I hope you got I have given a very simple language. I have not gone for a very detailed mechanism. I have just a simple definition why you need this combination, why it is this reason of this ratio of 1:10. I hope this will not forget by the student. So levodopa is actually the metabolic precursor of dopamine, does cross the blood-brain barrier, and presumably is converted to dopamine in the brain. So this is thought to be the mechanism whereby levodopa relieves the symptoms of Parkinsonism disease. Carbidopa is a drug that treats Parkinsonism disease by how? Preventing the conversion of levodopa into dopamine outside the CNS, outside the central nervous system. I hope you remember what I just now explained to you. And the next question we have asked about the bisocodyl should never be given to the patient with dairy product, milk product, or acidic. So we cannot give any dairy product or milk products or antacids, not acidic, antacids, and you cannot give this Dalcolex, that is bisocodyl. Bisocodyl is an stimulant laxative. It is not a smooth laxative, or it is a stimulant laxative. So it has to enter into intestine. So when you give sometimes dairy product or milk product or antacids, its coating will be going. Even it cannot be chewed. You cannot chew while taking this Dalcolex. It relieves the constipation and helping the bowel moves so that you can pour. That means it can be elevate, or you can evacuate the bowel more easily if you are not adding any dairy product or milk product at least 1 hour before or 1 hour after when you are taking this bisocodyl tablets like Dalcolex, which everybody knows, which is used for evacuating the bowel. And the gingival hyperplasia. What is gingival? Gingival hyperplasia in the teeth, that is the gums, will get gingival hyperplasia. This is gingival hyperplasia which occurs. They have given some drugs. Can you give which drug will have this contraindication? Which drug will have this type of complication when the patient is taking the drugs? So they have given a choice of phenobarbital, procainamide, and primidone and phenytoin. All four of them are used for anticonvulsive drug. They are used for anticonvulsion. They are used for seizures patient. So when you are using this phenobarbital, it doesn't have this type of contraindication which causes like gingival hyperplasia, and procainamide is also not causing this type of contraindication, but primodone is also not causing this type of gingival hyperplasia. But gingival hyperplasia is caused by phenytoin sodium. Phenytoin, when they are taking for this treatment of convulsion patient or in seizures patient. There are many types of seizures, you might have studied most of the thing, but at least you should remember the contraindication of some of the drugs which we are commonly using. So I hope some questions I have taken for very little class. So we will have a discussion in the next class with the next subject. One as early as possible. How much I can prepare, I will come to you again. Thank you. Please kindly subscribe my channel and do the needful.